Dr. Wong Jun Shyan, thank you so much for having a chat with us. Dr. Wong, of course, CEO and surgical ophthalmologist at ISEC. And this chat is really all about me not taking care of my eyesight. It all started with me being very nonchalant about wearing glasses, and I'm always complaining, oh my goodness, I can't see things. But then after that, we just realized how other people have it much worse. So, Dr. Wong, you've had over 3 decades of experience. Tell us about your love for ophthalmology.
First of all, I'd like to thank you for having me here. Hello everyone. Yes, you're right. It's almost 3 decades now I've been in ophthalmology. And ophthalmology is fascinating because this is a field that combines both medical and surgical fields. All right, so we do diagnose eye problem. We help people to find out what's wrong with your vision, and we give medical treatment in terms of eye drops, in terms of tablets. And yet we also can do surgery. That means that we also do hands-on using lasers, using our hands. We do all sorts of very, very innovative and very effective way to improve vision. So it is very fascinating. And I think what's better from the medicine point of view, that you always look into people's eyes. I think one eye is always one of the most wonderful organ in our body. So this has always been my interest.
Now, 3 decades, how has the field of ophthalmology changed from the time when you first started to now?
I think a lot of things have changed, all right? I just want to highlight a few very, very important changes. When I was training to be an eye surgeon, there's a condition called macular degeneration,
right?
Where there is a condition where there is abnormal blood vessels that grow in the middle of your retinal called a macula.
Right.
And this is uniformly blinding in the sense that people would not able to see fine objects if you have been afflicted with this serious condition in the eye. Mm-hmm. When I was doing my training, there were no effective treatment. In fact, it is so easy to diagnose and so easy to manage this case. That is that we tell patients that you have this condition. The good news is it is not going to be totally blinded. All right, you will still see from part of vision. The bad news is that there's really nothing that we can do about it, and you don't have to come back for any follow-up, because there's really nothing we can do. Of course, back in the days before 2005, all right? So in 2005, there were discovery in terms of a special medication called anti-VEGF, VEGF, which is very, very effective in reversing, all right, vision loss due to this condition. And since then, all right, the people who really progress to blindness, all right, from macular degeneration, if we are treated early enough, is in the minority, probably less than 10%.
Right.
So 90% of them can preserve very good vision if they get treatment early and sustained treatment. So this is just one example of what used to be almost a legally blinding condition, right, can be arrested. In form of like something more common, for example, all right, your cataract surgery, all right. Again, when I was entering training in the 1990s, the surgery was rather crude then, when you have to open up the eye, all right, with a 3 or 4 up to 6 millimeter incision. Now, 6 millimeter may sound very small, all right, in the macro view, but 6 millimeters wound in a small eye is very big. All right, because eye is only about 2.5 centimeters in diameter. So a very big wound to remove cataract would necessarily means that longer recovery vision. People take weeks to months before they see good vision. And most patients would still need glasses after the cataract removal to see well. But since then, we have what we call a phacoemulsification surgery, when the cataract is removed through a tiny incision, which is about 2.2 to 2.4 millimeter in size.
Wow.
So that's small. And these are a very controlled way of removing cataract. And because the wound is small, most people can see well within a few days after surgery. So, and the surgery has hastened from something that takes about half an hour to 45 minutes to most of the surgery that I do for cataract is less than probably 7 or 6 minutes or 5 minutes.
Really?
Yes, I mean the actual operating time. So that again is an innovation because of the advances in techniques, in technology. And last final thing I want to tell you is that in that 30 years being a surgeon, that we see that cataract surgery is just to remove a cloudy natural lens in the eye, which happens to everyone when we become older, and replace with a transparent plastic lens so you can see better again, albeit you still have to wear glasses to see well. Today, almost all my patients expect that not only after they remove your cataract, they are able to see well, they want to see well without glasses.
Right.
That means that it has become what we term a refractive surgery. Basically, also a surgery to get rid of glasses. So it is 2 in 1 now. You remove your cataract because it's cloudy vision, and you rehabilitate vision, and you get improvement in your vision. That means that prior to your cataract surgery, let's say you have to wear glasses to see distance, or you have to wear your reading glasses to read. Now we can implant a lens that corrects everything from short-sighted, long-sighted, astigmatism. It's a multifocal lens, so you can see well again without glasses. And this is forever, in other words, until we leave the earth. All right. So because the lens that we implant in the eye is going to outlast our lives because it's made of plastic. So this is, again, you can see that over 30 years, medicine and surgery itself, all right, including in the eye field, ophthalmology, has changed so much that the quality of life now is so much better.
It's fascinating because when you mentioned cataract and the 6mm incision, I remember when my mom actually had to do hers, and after that she complained about blinding lights, and then she wasn't seeing very well. She had to wear dark glasses because there's a period of adjustment. And you say now it's 2.2, 2.3 millimeters, and everything else gets better. It makes me wonder what things are going to be like 30 years from now, and how, like, will we won't even need to have glasses. We will never have eyesight issues ever again, is it?
Well, I think that I can only hazard a guess. I think in terms of cataract surgery itself, people are thinking about non-surgical solution. Maybe we can have eye drops, right, that put in the eye, and that reverses the cataract back to normal transparency. But that would restore the clarity of your lens, but it may not remove your need for glasses, because if you are born to have nearsighted or astigmatism, the eye drops restore clarity but does not remove the need for glasses. Now, if that eye drops that to remove cataract does not materialize, I think it will be still some form of surgery, although the surgery would be much finer, incision gets smaller and smaller. I think it will come to a size that it should be, it is no longer meaningful to do any surgery if it's so micro, all right, because you still have to have a minimum size of the lens to put in. So I think we are almost reaching there. We are talking about maybe routinely next time we can do the surgery through an incision of sub 2 mm, maybe 1.8 millimeter. Because the challenge is not just removing it through a small little hole, literally a small hole, right, to remove all your cataract, which is big inside the eye. Also to how to insert back a lens, all right, which is going to expand it to the normal size that fills up the lens cavity through that 1.8 millimeter hole, all right. So basically, it can be done because technology, the polymer plastic, you can actually now roll up a very tiny lens into like a cigar, insert it through the hole, and once in the eye, it open up again, all right. So things like that do happen.
That fascinates me. 6 to 7 minutes of surgery now. Next time it might be even shorter, right? But
yeah, probably 2 or 3 minutes, I suppose.
My goodness. But I'm sure that in the 30 years that you've been doing this, you've had a lot of major challenges, some more challenging than others. What is your most challenging surgery to date that you can remember?
Okay, I do quite a variety of surgery, all right. I think I am actually also a retinal specialist. The most challenging surgeries are still in the retinal field, all right, because cataract I think most people, most general ophthalmologists, means that people who do a surgery can master the skill relatively easy because the accessibility to cataract is easy. It is right in front of the eye, right? So it's very easy to visualize, and once you have learned the skill, you can do safe and good surgery. Now, whereas for the retina, the main challenge is located at the back of the eye. You can't take out the whole eye and open it up and then do things and close it up again. You have to approach. It's just like brain surgery, all right? With deep seated problem inside the brain. You have to go inside the brain, or it's the same here. We go to the retina through incisions that allow you to put your instruments to reach the retina, and yet, right? It is not so accessible. It's hard to visualize because you have to have special instrument, special scopes to look into retina at the same time, to magnify it into, so it literally looks like a 60-inch TV view in front of you, but it's all through magnifying microscope, so we can do tiny and fine surgery on the retina. So sometimes it's just very difficult to do, but you know that for most people who have retinal problem, a success repair means that they are not going to go blind, all right? If you cannot repair successfully, a lot of them will lose very meaningful, significant vision. So retinal surgery is the same. Sometimes I'm asked to do surgery on people who have really lost one eye from some retinal problem, all right? Especially diabetic patients. And what is presented to me is the only eye that's left, and they do not come at a stage where it is easy to do. It is almost next to impossible to restore, but I say, right, some people were given up, but for me, because I'm a subspecialist, I train in this area, so I do not give up if I still think there is a chance to restore vision. So by and far, even all these very challenging cases that present late in their disease stage, at my level, all right, if we do it well, we can save at least half of these patients from total blindness, which if they do not do anything, they'll certainty, right, they will go into total blindness. So these are the more challenging, and I must have done probably about more than, let me estimate, probably 5,000 retinal surgery at least.
Wow.
Right? Yeah. So again, majority of this, thankfully, all right, most of them, like most well-trained retinal surgeon, you are able to solve the problem in 90% of the time. All right. So I would say that, right, so of that many people who come through me, a lot of them are really dependent on their only eye. All right. This is what we are able to do. And this is the thing that drives me, keep me driving. 30 years of doing it. We have our fair share of failure because I say we are still human. We can do the best. There are some people who would fail. And when you fail, it's really sometimes discouraging, or sometimes the stress of failure. All right. Sometimes, in medicine, it's not like other profession. All right, I suppose other profession too. You have when you fail, it has a very big implication. Like pilot, right? You can't fail. Yeah, there's no room for failure, right? Similarly to us, I say that if you're not able to save something, all right, sometimes it's just not us. We just can't do it anymore, right? So the disease is so complex. We try our best, but it's the facing up to that. Something that you couldn't do anymore, all right, is very stressful, all right? Sometimes I get discouraged, but it is all those positivity, all right, that drives me on, all right? And so if looking back to the young ones who wants to be in the surgical field, whether eye or not, I think you have to be very honest to yourself, right? What's your motivation, all right? Your motivation, if you enjoy, right, seeing that you can make a difference to people's life, right? Despite the challenges, despite the stress, despite the, you will encounter, all right, good times, you encounter bad times in your career, all right? So, but these are part of the challenges, and that you have to manage it well.
Now, earlier you actually mentioned, like, in some cases, like diabetics, they have retinal failures in some cases, where you manage to, in the many thousands of cases that you've done, 90% were successful. Then there were the 10% where you would probably haunt you in some cases. So in one of the worst cases that you had to deal with, what I mean, like, it's not just diabetes, I'm pretty sure. What would have caused eye damage to the point where it needs major surgery, that they would have to go to you, a specialist? And what was that procedure that you did to kind of restore their eyesight?
If you look at diabetes per se, all right, I think it's important because in our country, Malaysia, we are one of the highest, among the highest diabetic prevalence. That means the number of people who has diabetes across the community is very high. Roughly, there's a survey that look at the nation, about 12 to 15% of population are diabetic. That means for every 100 people out there, right, 15 of the up to 15 are diabetic. And diabetes ravages the whole body if you do not control the sugar level well. And eye is one of the organ. Now, how does it affect the eye? Is that when you have a state of prolonged high sugar in your blood, all right, you cause some changes in the blood vessels. The blood vessels, in a nutshell, tends to get blocked, all right, or they get damaged, just like a water pipe, right? The blood vessels, you get leakage from a damaged pipe. So the leakage of protein or fluid or blood into the retina cause the retinal to be swollen, because retina is a thin layer, just like film in the camera. But inside this film, you have a lot of blood vessels. So you can get very swollen or bleeding in the retina, so that interfere with function of retina. Retina is actually like a film to sense image in the film in the camera. Or you can get blockage in the blood vessels. When the blood vessels is blocked, the retina will deprive of nutrients, all right? So that is a basic mechanism. There's no nutrient, no oxygenation, or very abnormal functioning retina. So the eye will start to, as a response to this, all right? Because we are living things, the body will respond to any inflammation or any injury, or this is an insult or injury to the eye. The body would produce some growth factors, some chemicals that would try to compensate for all this problem. Because the body sense that there's no oxygen not enough oxygen in the retina. So these growth factors will start to grow blood vessels. So you can imagine the blood vessels that start to grow on the surface of retina. It's not supposed to be there. It's just like in a nice manicured lawn, all right? You can see weeds and creepers start to creep into your lawn, all right? So all these blood vessels, you distort the retina, it causes scarring the retina, and so the retina get all crumpled out. Instead of nice sheet of retina on the eye, crumpled up, distorted, detached, right? And this causes vision problem. So when we do surgery to restore that, we need to remove all this abnormal sheet of blood vessels. We are cutting on the scar tissue, on the blood vessels. It's very bleedy, and we try to restore back normal anatomy. All right, so that is the challenge. And these are removing all this abnormality on the very, very fragile nerve surface. All right, this is nerve. You don't want to destroy normal nerve. You want to remove things that are not supposed to be there, and these are all talking about microns, all right? And the view is a challenge as you cut into a blood, all right? Blood vessels, these abnormal vessels, blood will spill out, you have to dry it up again and continue and do it, all right? So, and all this done under a microscope, all right? It's bad enough you do a naked eye surgery, you can see well, this is under microscope, and then you do it, very fine manipulation. So this kind of surgery inherently is very challenging. All right, so that's why I do about 5,000 complex retinal surgery, right? That is already a lot of experience from my point of view, all right? So nowadays, looking back, all right, so some of the things that when we do when we first younger and when technology was more crude, was not able to do if this patient has presented, means they're born 20 years later, all right, and presented with certain amount of complexity in the retinal problem. And we are so much more better able to save the eye compared to, say, they presented in 1990s, even the same problem, all right?
Has anyone ever been, like retinal problems, do they ever go completely blind, or do they go partially blinded, like 90% blind? And is that even restorable?
Well, yes, you can go totally blinded as in like you don't see a thing, all right? If the retina is totally damaged, all right? Because it's nerve, just like brain, you have total brain damage. Of course, there's all various shade of gray. You can have a little bit of impairment, all right, to very severe. That's why it depends on how severe is the condition when you present and how much more we can do to salvage it. So there's no one magic formula. Therefore, even in diabetics, they can be a very simple case, right? Just a few blood vessels to remove, and then the patient can go back to normal vision, or to the most complex case where we are the aim for surgery. Sometimes we tell a patient that to be realistic, it's not to restore good fine vision like me and you. Is to preserve what you call navigational vision.
Right.
That means that if I have got, let's just say, just a blur vision, at the best we can have just blurry patch, but I can see a person there, I can see a chair here and there, all right? To me, that's much, much better than total blindness, right? So this patient, although I cannot read my book, I can't see your face, I can walk around without people putting my hands.
But driving, probably not, right?
No, of course not. All right, we have our standards for driving, right?
Yeah. Now, eyesight is probably, in my book anyway, one of the most important senses that we have, and also easily one that it's probably the one that I neglect the most as well. What are some of the things that we should be doing to take care of our eyesight? I mean, considering that we may be healthy, we're young enough, what's the best way to take care of our eyesight?
Okay, to answer this, I would probably categorize into different category. First thing is age, all right? So by far, the most of us young adult means that you're a teenager, you grew up without any problem as a baby, all right? You're seeing well, there's no symptoms in your eye, all right? You don't really need any specific eye care in the sense that just a healthy, common sense lifestyle, good diet, until when you reach about 50s, then you probably need to see eye doctor. You start to have an annual program of surveillance, because a lot of our diseases, just like in our part of body, right, comes when we are not so young, right? So a good time would be about 50 years old, then you go and see an eye doctor on a regular basis. But while we are young, all right, of course, we shouldn't abuse our eye too much, all right? Like say, if I wear contact lens, I should know how to take care of the contact lens. I shouldn't sleep with my contact lens overnight, because that would predispose my risk for a very bad corneal infection, all right? So again, like contact lens need to be disposed of, it need to be clean if you are reusable type. When there's a finite lifespan, you have to change. A lot of people tend to abuse that, all right? So just have a healthy lifestyle. Now, the issue about screen time, everybody ask me, would I hurt my eye in the sense of harm my eye if I look at my iPad, computer, or my iPhone, or whatever device you have? The short answer is though, you're not going to harm or danger in that sense. But obviously, your eye will be very tired, all right? Your eye will get very dry after some time, because as we use our eye to look near, albeit the screen or the book is a near activity, right? We don't blink so much, all right? Our eye is always moist. Therefore, if you use a fan and blow on your eye or aircon on your eye, you feel very, very uncomfortable because it dry up. So there's this moisture there. Now, to help this moisture, to maintain this good moisture firm on the eye, we blink. That's why you cannot say you don't blink. Even you try to hard not to blink, eventually you blink, all right? So the blinking is a protective thing to, like a smear, all right, our tears on the eye. Now the blinking rate, when we are having a good time, like having a party in a pool, is average about 25 times per minute. But when we are intensely focusing on near or screen, all right, we blink much less, probably about 7 to 10 times a minute. So this lack of blinking, all right, causes the evaporation of a tear from our eye. So prolonged, sustained near activity causes our eye to be very tired and dry. So in the sense that you get very tired, all right, you don't harm it in the sense, all right. So again, healthy lifestyle means that if you are looking a lot for using your eye to see near a lot, maybe every half an hour, rest your eye, close your eyes a while, or don't look near anymore, right? Walk around, have a chat, listen to music for 10 minutes, 15 minutes, then continue on your intense near activity, right? So that will be not so dry and not so tiring. But you can just put artificial tears in your eye. So again, this is generally some of the things that you can do, all right? Healthy activities, know what to avoid, like contact lens, don't wear with them in your sleep, and be aware that you need to check up when you're not so young anymore, even you felt that your eyesight is good, if you're a normal person. If you have a disease-specific condition, for example, just now we say you're diabetes, right? If you're diabetic, then regardless of your age, right, you should actually see your eye doctor,
right?
A year or so after being diagnosed, or a few years after being diagnosed, right? Because we want to see whether it has an effect on your vision. Now, special cases for child, all right? I think most of the modern healthcare facility, if you are born a newborn, the neonatologist, the child doctor, would go through the whole body, right? Look, see the arms are okay, your teeth are there, your eye is good. So they'll give a screening. If they see something not right with your eye, all right, as a newborn, they'll refer to an eye doctor to a screening. A certain disease-specific condition, again, in a child. For example, you're premature, and as a rule, when you are very low birth weight, right, most babies are born above 2.5 to 3.5 kilogram on average. If you are less than 2 kilogram because of the prematurity of malnutrition, right, you should be an eye check, because a lot of them have eye condition too, right? So the neonatologist, the pediatric doctor, should arrange for that. In fact, in some countries, if they are premature in the ICU, they do not have eye screen, it's negligent, all right? Because you must get an eye doctor to look at the eyes. Again, I think in our school health system, all right, whether it's conducted well or not, I do not know. There will be school nurses also to assess child going age, school children. That's why if you can remember, when you go to school, they will check your eyesight to make sure that you see well. If there's any shortfall, all right, in the standards, in the minimum standards of vision required, they'll ask you to see your eye doctor, all right, whether they need glasses or anything wrong. So there are different checkpoint in our lifetime, all right, that we want to see if you have eye problem. So the children are usually taken care of some program, a healthcare system or school system. If you progress from there without a major problem, you don't have a squint, developing lazy eye, which is being detected in a school, all right, you probably will lead a healthy lifestyle. Now, the pandemic now, not the COVID virus pandemic, is the myopic pandemic in this
myopic, right?
Myopia. You can see more and more young children are actually wearing glasses.
Yeah, I noticed that, yeah.
Yes, so that's why I call it a pandemic. It's going to be such a global issue. Especially, there are many reasons why people wear glasses, all right? Nature and nurture. Nature means genetics. We can see that in some race, for example, the Oriental or East Asian, the Chinese race, the Japanese, Taiwanese, Korean, all right, the East Asian race, the rate of people wearing glasses for short-sightedness is very high. If we look at some survey in Korea, Hong Kong, and Singapore, all right, a Chinese descent, all right, stock there. In high school, probably 70 to 80% people are short-sighted. That means that almost everybody there wear glasses, right? It's shocking, right? This is so many of them. Even in Caucasian races, now it's going to be a big problem. 30–40% of them start to wear glasses. Again, of course, the disparity is, of course, different racial profile, right? Different genetics. Or if your parents are short-sighted, most likely you are short-sighted. Therefore, the genes for myopia is somewhere there. All right, there are a lot of research going on, trying to find out those genes. It's not going to be one single gene. It's probably multiple genes, all have the same effect. And nurture, that means that lifestyle. Okay, just now when we say that nowadays near activity is so rampant. Toddlers are actually looking at screen, right? Not so much a screen is going to spoil their eye, but the near activity induce short-sightedness. Right. Therefore, there's some truth in people who read a lot of books. We call bookworms. They are short-sighted. The stereotype is they wear glasses. Yeah, because they spend so much time looking near, right, as a child, right? So they develop short-sightedness. It's been verified. If you spend so much time like that, you're going to wear glasses. But hey, in this competitive world, how not to read? Exactly. Yes. So what we find that as an eye doctor, at least we know 2020, we say that yes, you cannot, all right, escape the fact that you're going to read from your near device. A lot, I read a book or iPad, but please stop and rest your eyes, like what I mentioned just now. Every 20 minutes, the rule of 20 minutes, stop for 20 minutes.
Right,
and
okay.
Look at somewhere far, 20 feet away.
Look
right?
at pretty things, look at greens and everything.
Correct.
Is it? Right.
Far. Don't stop looking at iPad and then go and look at another thing near, right? You're still sustaining it. So
Right.
20 minutes of a near work, stop, rest for 20 minutes, look at something that at least 20 feet away, all right? Means that don't go back to a near activity.
Right.
You do that in little aliquots, you break into little time, segments. The rate of developing high short-sightedness is actually much lower.
Right.
And then we also find that, okay, activities, you see in Australia, a lot is an immigrant society, right? So they are the same group of people from Hong Kong, Taiwan, Singaporeans, or Malaysians, among the Chinese stock who has very high incidence of short-sighted when they reach high school. If they migrate to Australia, same people, you don't get the kind of numbers. Right? You don't get a lot of people all wearing glasses if they have migrated as a kid. Why? It's a lifestyle. See, in Australia, the curriculum in school places a lot of emphasis on ECA, sports.
Right.
You know that unlike some of these very competitive Asian way of measuring how successful you are in school.
Academics only, right? Yeah.
Yeah. In Australia, if you don't have good ECA and good sports, you may not even make it to university, right? So when you put that kind of emphasis on that, the parents will make sure that no, you have to do something outside, right? Do some outdoor activity. So we think that spending time outdoors, all right, and again, a lot of people try to verify from epidemiology study of the population, people who spend time outdoors tend not to wear glasses. Right. So again, to answer your question, how can protect our eye? If you are a child, you're at risk of short-sighted, means you're starting to wear thin glasses when you're very young.
Yeah.
It's destined to go thicker and thicker because once you are a teenager, you'll be spending so much time. Maybe you want to temper your activities, right? So I encourage my patients' parents, when they ask me what to do, say, let them go out, all right? Ask them to go outdoor in the playground, whatever. Get some sun, right? 1 or 2 hours in a week at least, all right? So that may probably help. And lastly, there is also a eye drop now. We have discovered that we put one drop in the eye every night, all right? It's very safe, not much side effects. You can slow down the progression of short-sightedness.
Right, really? Okay.
Yes. So in research, again, like I say, things have changed. I did mention to you earlier in the program, yes, this is something new also, which has been validated, tested in many children worldwide, and they find to be very effective. We call atropine eye drops. So this, again, you must get prescription from your eye doctors. And lastly, what else you can do to take care of eyesight? I think that you don't have to take any super supplement, right? I mentioned the age-related checkup, disease-specific, the special child group. A lot of people always say that, oh, should I take some vitamins, antioxidants? There's actually no evidence for a general healthy person that you take all these vitamins and supplements or what have you, you're going to protect your eye from disease, all right? So as a rule, not necessary, all right? Worse still, you don't know what is the side effects of all these high dose of supplements.
Yeah.
So, and it's not going to come free anyway, all right? If you put away that $200 a month you spend on supplement into a retirement fund, all right? I think it's a better return, all right? So this is what I can share with all our audience.
Right. Now, the thing is, though, there are a lot of myths about eye care. I remember if you eat carrots, your eyes will be better. But if you drink lots of water and probably don't smoke, does that help in reducing any issues that you might have with your eyesight? Lifestyle, basically.
Okay. Well, I suppose when we eat a balanced meal, right, that has got different kind of leafy and colored vegetables, right, that all those provides a lot of vitamins, right, and a lot of antioxidants. And we know that the eye is very essential on normal amount of vitamins, right? For example, vitamin A is very important in the physiology of the retina, right? That's why vitamin A deficiency can cause blindness or night blindness, right? So Yes, there's some truth in it, right? Carrots, all the colored vegetables has got a lot of vitamin A, right? So, but you don't have to like excessively eat until your skin become yellow, right? Because there's a condition that eat too much of yellow or orange color fruit become yellow. Although that's harmless, right? Yes. Then the other thing is that, sorry, I forgot what's the question.
So drinking water, smoking as well.
Okay, smoking as a whole, of course, it has a lot of harmful effect on the body, all right? This has been proven in, especially with regards to lung cancer, blood vessel disease, right? That means it precipitates heart attack more. From the eye point of view, smoking has got one important effect on the retina, all right? Heavy smokers are more prone to get macular degeneration. I mentioned before the condition where the degeneration retina. Macular degeneration generally occurs in people 50 years and above. So it's an elderly disease. So smokers are 4 times more likely to get the problem, or their condition are probably much more severe if they continue to smoke. So as a whole, if you can quit smoking, all right, you probably can delay some of this progression of disease if you already have, or probably you make it less likely to get some of the disease in the eye. We know heavy smokers, also chain smokers, tend to get cataract, all right? I suppose it's again some chemical changes in our body, all right, from all this, we are inhaling a few hundred types of chemical into our body every time we take a puff, all right? So it has effect on the eye. So these are the 2 main things that the direct cause from smoking. Of course, the other indirect would be like effect on your blood vessels, right? If you're diabetic, blood vessel disease, you smoke, you get more likely to get problem in the eye too, right? And drinking water, I'm not aware of how, you drink a lot amount of, plenty amount of water, you can prevent any problem in the eye. I suppose there's always a physiological range that if you must hydrate yourself adequately to have a good function for the body.
Now, obviously there's always going to be complications to a lack of eye care. Simple things like rubbing your eyes constantly, because sometimes you work so much and then you're trying to see something, you lift up your glasses and you rub your eye. That can cause like abrasions to your eye, and I'm pretty sure that's not something that you recommend as well, isn't it?
Well, I mean, a bit of rubbing here, I suppose, is probably quite harmless, right? But of course, over vigorous rubbing, like say the mechanical effect, right? You can cause abrasion in the eye. So again, be careful when you need to rub your eye because of itchiness. But there's a condition, all right, where people tend to rub chronically. It means they rub almost every day, they rub their eyes, right? Most of these people has got allergy phenomenon because their eye is itchy, right? So people who are born very allergic with your allergic rhinitis, means they sneezes in the morning every time they wake up, the asthma, they tend to rub their eyes a lot. And a lot of these are children. So a chronic rubbing of the eye, always rubbing the eye, yes, it has effect. It actually deforms the shape of the eye, right? Our eyeball, you can visualize it, is almost like a sphere, like a football, round. If you rub, chronic rubber tend to precipitate the eye to deform to a shape that is more like an egg shape, all right? So it causes the eye, especially the front part of the eye, to be not rounded but more oval in shape. So, and if it can also precipitate a condition called keratoconus, where the shape of the cornea, the front part of the eye, is transparent, where we put a contact lens, is no longer shaped like a round football. It is shaped more like a cone shape, right? Wow. So a conical eye, right? Cornea, so it's keratoconus. And it will manifest if the astigmatism is very irregular and very high, right? Astigmatism means just a true reflection of the irregular shape of the sphere, right? Become a more rugby ball or oval shape. So if it can be progressive, this condition, and then eventually the vision is so bad that you cannot be corrected with glasses or contact lenses. You may need a corneal transplant, where you remove the cornea that is already out of shape and put it back with a new donor cornea, donor cornea, which is a regular shape. So yes, chronic rubbing can cause problem, all right? So when we see young children, when the parents brought in and say that he's rubbing his eye a lot, right? So most of the time it's due to allergy, and we give anti-allergy eye drops, which stop the itchiness, the irritation, and then it stop rubbing. And like I said, most allergy in our in us, we grow out of it. We become desensitized. That's why you say I got asthma, which is a lung allergy. All right, you say that as a child, then after that I grew out of it. All right, but sometimes you come back. So same here. This is usually in the childhood. If we tie over that period with anti-allergy eye drops, right, then they won't have a problem.
Is there anyone in particular, any eye or lack of eye care that could potentially lead to blindness? I mean, like simple things like rubbing your eye.
I think most common sense activity, all right, would not lead to blindness, all right, unless you're engaged in very dangerous kind of sports. For example, if I'm going to be a sports person, all right, and I play squash or badminton, in ideal world, you should wear goggles, right, protective goggles, because you see, when you smash a shuttlecock or you hit a squash ball, the speed that they travel is very high, in excess of almost up to 100 kilometers an hour, right? You can see sometimes in tennis, they will tell you how fast the ace, right?
Correct.
But I see, unlike tennis ball, which is big, all right, it doesn't rupture the eyeball. When you hit by tennis ball, even on a high velocity, because our bony outer bones that on the eye socket, all right, would crack first and protect the eye from rupturing. But the shuttlecock is small. The squash ball is small. It just goes straight into the eye and fitting into the eyeball socket without hitting the bone. And it can rupture, smash your eyeball. All right, I've seen quite a few of this. All right, happening, and some of them go blind. Right, we cannot repair it anymore. So therefore, yes, certain activities you must have eye protection or eye care. All right. Now, if I'm a hobbyist, I'm going to do a lot of sawing using machine,
woodwork and everything, right? Yeah.
Yeah, woodwork. That's why you see in this part of the world, because eye protection is not second nature. You can see a lot of documentary when people show you woodwork. First thing, right? They'll put in the eye protection and they'll do all these things. I can see a lot of even industrial accident where they are fouling something and say, I don't wear any eye protection.
Right.
And all this projectile debris comes in the eye. So again, sometimes we try to knock nail on the wall, right? Any knocking on a hard surface, all right? Would also, you need to wear protective eye protection, because let's say you knock a hard thing on a hard surface, there will be a deflection sometimes, and that missile can shoot into the eye.
Right.
I have lots of interesting but horrific picture of how nail is sticking out from the eye, and all these things happen.
Oh my God.
Now, yeah, and so the other activities, like for example, if I have seen people who go bungee jumping, right, and then because of the pressure, the jerk in the bungee rope, right? They get spontaneous bleeding in the eye, all right? Sometimes it can be quite problematic.
From bungee jumping?
Yes, you can get that too. But I suppose not everybody gets that, so these are extremes. So that's why certain activity would increase your risk to eye injury. So you have to assess that I want to do the activity. If I can avoid that, how am I going to protect your eye? I mentioned before, eye goggles when you play certain sports, right, or activities. So as a whole, like I say, there are things that we can do if we identify that it can potentially threaten the eye. One last thing, I see a lot of this, all right. Most of us know that we need to wear a seat belt retainer, self-restraint when we drive.
Yep.
I see quite a few people who, as a patient, everywhere, whether in this part of the world or overseas, they don't wear. And they'll get into even minor accident where they knock their head against the steering wheel or the glass shatter, they lose their eye. Right? So again, this will have totally preventable, right? There is no other body injury. It's just the eye, right? It just always have to hit, not just between the nose and the eye with something hard and the eye gets smashed.
There's a lot of common sense preventable injuries, actually, if you just think about it, right? But in my case, let's just say for me, I've got astigmatism and slight short-sightedness. Are there treatments? I mean, and I represent maybe most people who are like me. We work in front of a computer a lot. We we work 8 hours a day, and then we forget to drink water or forget to put eye drops. I try to put as much eye drops as possible. Does that aid eye care? I mean, like eye drops and trying to look into the distance, look at green things sometimes.
Okay. All right. I presume you are over 18 years old, right?
Yes.
Okay. Once you have reached adulthood, as in that your body is no longer changing anymore. Any amount of activities near mainly serve to tires your eye, like I told you, right? But it doesn't induce increase in your myopic power anymore. All right. So as when I mentioned to you, the near activities are only pertinent in children when they are growing. Every one of us will grow to a stage and we reach maturity. So similar to the eye. Once the eye reach maturity, there's no longer increase in the eyeball size or shape, all right? So that's why their power stabilize. So yes, if you are young, if you are in school age, a lot of near activity is harmful because it will induce short-sighted progression. So that's why their power get higher and higher and higher.
Right.
So that's where I mentioned just now you should rest 20 minutes, 20 feet vision. But for your case, that since you are a young man now, no longer a child, you do not need to worry about increasing the power or it's going to harm you. Certainly it's going to tire you out, all right?
Yeah.
Now, your other question, I already have short-sighted and astigmatism. If I can't see well without my glasses or contact lens, right? Maybe a little low power, you may not be reliant on that, right? You may only want to wear your glasses when you are driving or night vision not so good. But once you reach a certain amount of short-sightedness or astigmatism, the degree of it is significant to blur you out. You may have to wear glasses. Now, if you do not want to wear glasses, is there any way to reverse it? You can't reverse it naturally. You can reverse it with surgery, right? So that's why laser surgery. But the underlying problem is that your eye is still a short-sighted eye, all right? Short-sighted eye are prone to get problems, even if you are cosmetically reverse, right? The short-sighted, that means that you don't need glasses to see well because it changed the focus of the surgery changed the focus of your eye so that you don't rely on glasses. Your eye is still at risk of problem, all right? Since you have brought up the short-sightedness, what are the problems when people are short-sighted? You are more prone to get retinal disease, all right? You are more prone to get retinal tears, retinal detachment, all right?
Ooh, really?
And also you are more prone to get bleeding the retina, and you are more likely to get glaucoma, you're more likely to get cataract at an earlier age. Therefore, short-sightedness, I mentioned earlier, is going to be a pandemic. It's going to be a big problem. People are all going to wear glasses in certain country when, like in Singapore, I know, I grew up there as a student. When the military wants you to do national service, they find it difficult when so many of them are wearing glasses.
Glasses, yeah.
What are you going to do, right?
Yeah.
In a combat, it is not good to have glasses. I mean,
Yeah.
All right. Or to find suitable pilots for their fighter pilots, Top Gun pilots. If there's so many, 80% of the cohort is wearing glasses, the top people are physically fit or have the mental strength to be a Top Gun pilot, but they're wearing thick glasses. What are you going to do? So it may be a problem in some population, from a strategic point of view. All right.
For some jobs, you need 20/20 vision.
Oh yes, there'll be pilots. So there are different rules again, whether you need, you can be corrected, right? Where you can use laser to correct and then engage in that kind of activity. Again, the standards are changing, right? As people understand whether the performance of the vision is not affected by the surgery and it can approximate somebody with good vision. Some airlines, they still allow you to be a bit short-sighted, all right? But you can correct your vision to good vision, they allow you to fly, all right? Again, different rules apply in different situations.
So in general, that means at some point in time, at a certain age, there's not going to be any way for you to just reverse it unless you just wear glasses or you go for surgery. So just kind of accept how it is.
Yep, in a way, pretty much, unless
you're going blind, of course.
Yeah, I mean, you're not supposed to go blind, right? Even you are short-sighted. If you say that I'm very short-sighted, but now my vision, I start to have problem, not able to see well, I think you better pay me a visit.
Right. God, that's pretty extreme already, right?
Yes, yeah.
So what's your advice to Malaysians where eye care is concerned?
Well, my advice is that, again, session like this is very important. First thing is that you have to be aware, all right? So that if no awareness, no education, all right, so you may not know something is wrong. So as a take-home message, all right, I think that if you have any symptoms, all right, I always tell my patients that if you are able to see something before and now you don't see it, all right, or the thing cannot be seen already, something's wrong, all right? That means that either you lose your vision, you are losing some vision, or you are seeing things that is supposed to be a certain shape or normal shape and it become abnormal, distorted. Let's say a line, all right, used to be straight, now it's crooked and wavy. Not right. You have to see eye doctor. Or you're seeing things that are not supposed to be there, right? For example, that I'm not supposed to see these flashes of floaters, all right? I'm not talking about ghosts. Right? You also need to be seen by eye doctor. Why are you seeing things that are not supposed to be in your vision? So these three conditions, all right? So that's very common sense. Any symptoms are not right, don't delay, because sight sometimes can be very urgent. I mean, certain, especially is involving the nerve, all right? Nerves are very prone to damage. So we have to make sure that you don't have something that we need immediate attention. So again, unlike most branch of medicine, there are very few conditions that you are going to need immediate attention, all right? Sorry.
No worries.
This is very edit. There are very few conditions in eye that you may need an emergency condition, actually. I think number one is that if you have open globe injury, all right, there's trauma, yes, you must go to a hospital or A&E. Or very, very painful eye from something you cannot explain, for example, a glaucoma or a bad infection that causes really painful eye, you go to emergency. Anything else, let's say that, like what I mentioned just now, you see something crooked, no, you see some floaters or flashes, I can't see well from one side eye, you don't have to wake up at 3 a.m. and decide you go to the A&E.
Right, yeah.
The next day, go to the nearest eye clinic and see what's wrong. Because usually when we say urgent attention, it's not going to be an emergency because nobody is going to operate on an eye at 3 a.m. anyway, right? And you go there, most likely it'll make you wait until the next morning for the eye doctor to come in. All right, so this is what I tell my patient. So, but don't take your eyesight for granted, basically, right? Correct, yeah. So, and lastly, like I say, there's certain disease-specific thing, all right? You just have to be aware, like you're diabetic, get your eyes checked, all right? And when you're age 50 and above, is ideally have your eye checked once a year because some early blinding condition like glaucoma, you do not know whether you have glaucoma until the doctors tell you so, all right? And you cannot feel it, all right? Until when you can feel it, it's too late because you're blinded, that's why you can feel it, right? Yeah. So this is where some patients do not understand. Brilliant. Dr. Wong, thank you so much for being so frank with us and being so, my mind has been opened up to so many different things because sometimes I wonder whether we're doing enough to take care of our eyes and all. But thank you so much for this chat.